Dear students, let me take up an important topic in the respiratory system, that is acute respiratory distress syndrome. Now, the word acute stands for that the disease of onset is within 7 days. This is what is the meaning of the word acute. The word itself tells that the individual is having acute respiratory distress. Alright, so in the sense, the individual will have, difficulty in breathing, which is sudden in onset. That is what is the very important thing what you see in the acute respiratory distress syndrome. Now, in these patients with the acute respiratory distress syndrome, why do they have the respiratory distress which is sudden in onset? Why? Because the very important point what you should remember is, in these patients with the ARDS, there is diffuse pulmonary parenchymal disease. Alright, so the lung which is being damaged is not at one particular area of the lung. It is diffusely, that means throughout the lung, and that too both the lungs are affected very badly, and that is the reason why the individual is having respiratory distress which is acute in onset. So the point that you should remember is, these individuals, they are having diffuse pulmonary parenchymal disease. Right, diffuse pulmonary parenchymal disease. Now, the other very important point what you should remember here is that because of diffuse pulmonary parenchymal disease, these individuals, they land up in what is called as the pulmonary edema. But what type of pulmonary edema is that? The type of pulmonary edema what these individuals will have is called as non-cardiogenic pulmonary edema. I'll give you a detailed explanation what do you mean by cardiogenic and as well as non-cardiogenic pulmonary edema. But for now, remember, ARDS will cause what is called as non-cardiogenic pulmonary edema. Now, because of the development of non-cardiogenic pulmonary edema, where there is excessive fluid accumulation within the lung, and that is the reason why the exchange of gases will not occur, and that leads to a sudden onset respiratory distress. So because of this particular non-cardiogenic pulmonary edema, these individuals will have a severe respiratory distress, right? Will have severe respiratory distress, and along with the severe respiratory distress, these individuals will also have hypoxia. Right? These individuals will also have hypoxia, right? Which is nothing but decrease in the oxygen concentration within the blood. Now, what are the characteristic features in these patients with the ARDS? A point that you should remember is that in these individuals, ARDS is characterized by, right? It is characterized by the inflammation of the lung parenchyma. Right? Characterized by inflammation of lung parenchyma. Now, so because of the inflammation of the lung parenchyma, right, there is impairment of the gaseous exchange. Right? There is impairment of gaseous exchange. Now, because of the impairment of the gaseous exchange, what is happening in these individuals is, these individuals, they are suffering from what is called as the hypoxia. Right? These individuals, they are suffering from what is called as the hypoxia. Okay. Now, so along with hypoxia, what will happen is, now because of the hypoxia, the oxygen supply to different organs is reduced, and that is the reason why these individuals, will have a multi-organ failure. Right? These individuals will have what is called as the multi-organ failure. So this is a very important point that you should remember. In these individuals with ARDS, they will have multi-organ failure. Let me tell you a very important point is that ARDS is that clinical condition where the individuals will have very bad prognosis. The outcome of these patients is very less, right? Next, the other important point is that these individuals, they're having respiratory distress. Now, because of the respiratory distress, the individual is landing up in hypoxia, and that is the reason why all these patients with the ARDS, they will be requiring mechanical ventilator for their respiratory support. Okay, so this particular condition, right, this particular condition, it is often fatal, and usually these individuals will require mechanical ventilator. Right? Usually these individuals will require mechanical ventilator for their support. And all of these individuals, they will be requiring the ICU care. Right? They will be requiring the ICU care. Next, let me tell you one very important point here. If you take ARDS, it is a very severe form of the diffuse parenchymal damage where the individual is landing up in respiratory distress. But there is one less severe form of ARDS, and that particular less severe form of ARDS is called as the acute lung injury. Okay, so if you see the less severe form of ARDS, that is called as the acute lung injury, right? That is called as acute lung injury. Now, this is the basic introduction of the ARDS. Now, I will just show you a question in what way the questions can be framed in the ARDS topic. So, if you see this question here, acute lung injury is caused by all except, right? This is the question which is being framed on what exactly is the etiology of the ARDS. The options are aspiration, second option is toxic gas inhalation, third option is cardiopulmonary bypass with heart-lung machine, and lung contusion, right? So this is the question. So the question is being asked as except. That means the question is asking which is the incorrect option among all these which will not cause the acute lung injury. So what I'll do is I'll discuss the etiology of the ARDS and then we will come back to this question. Now, if you take this etiology, let me tell you one very important point here. The important point is that, right, the important point is that the most common cause of ARDS, it is sepsis. Okay, so most common cause of acute respiratory distress syndrome is sepsis. Now, a point that you should remember is that there are many etiologies which are causing the ARDS. Now, what I will do is, I will tell you all these etiologies in the form of a mnemonic, right? And what is that particular mnemonic is? The mnemonic goes like this. That is, septic patients, right? I said you the most common etiology is sepsis, right? Now, the mnemonic is septic patients. So do you think that the septic patients will have good prognosis? No. Septic patients may die. Alright, this is the mnemonic. Now, we will see what are all the etiologies according to this mnemonic. The word S stands for sepsis. Right? This is the most common cause. The word E stands for embolism. Right? Particularly the pulmonary embolism. Next, the word P stands for pneumonia. Right? The word P stands for pneumonia. What all pneumonias can cause? One is the community acquired pneumonia and the other one is the aspiration pneumonia. Right? The other one is the aspiration pneumonia. So these are the two pneumonias which can cause the ARDS. Next, you take T. T stands for trauma, right? That is a very severe trauma, and not only trauma, and even in patients with burns, they may land up in the ARDS. Next, the word I. I stands for inhalation. So I stands for inhalation, that is particularly the smoke inhalation. Alright, next, after this I inhalation, then we have the word C. The word C stands for certain drugs. What are those drugs? Like cocaine, right? Drugs like cocaine, then opioids can cause ARDS, then tricyclic antidepressants can cause ARDS, then another drug like what we have is aspirin which can cause ARDS, and then phenothiazines, right? Then phenothiazines. So remember, these are the drugs which will cause the ARDS. So after the word septic, then what we have? Patients, that is P. The word P stands for pancreatitis. Right? The word P stands for pancreatitis. Along with pancreatitis, you take another clinical condition, that is post-CABG. Right? These are the two clinical conditions which can cause ARDS, right? Pancreatitis and post-CABG. Remember, post-CABG where the individual may land up in infection and may cause sepsis and may cause ARDS. But remember, cardiopulmonary bypass with heart-lung machine will not cause ARDS. So this is an important point that you should remember. Next, the word M stands for massive transfusion. Right? Massive blood transfusion or massive transfusion of the fluids can cause ARDS. And along with that, remember, even aspiration of the gastric contents can cause ARDS. And lastly, you see the word D. The word D stands for disseminated intravascular coagulation, and along with that, drowning can cause ARDS, and the patient on dialysis can cause ARDS. Okay, so these are all the etiologies which will cause the ARDS, that is acute respiratory distress syndrome. Now, there are some multiple choice questions regarding the etiology of the ARDS. Let me tell you them. So the multiple choice questions here are, number one, as I have already said you, the most common cause of ARDS overall is what? That is the sepsis. That is fine. Next, the other question is like this. Remember, now this ARDS can occur, okay? Remember, this ARDS can occur either, right, either by the etiology causing the direct lung injury, or the ARDS can occur either by the etiology causing the indirect lung injury. Now let me tell you which is the most common cause for direct lung injury causing ARDS and which is the most common cause for indirect lung injury to cause ARDS. Okay, so if you see here, so ARDS can occur either by, right, either by direct lung injury, right, or ARDS can occur by indirect lung injury. Right, indirect lung injury. Is that clear? Now, you take the most common cause of the direct lung injury leading to ARDS. So here the answer will be pneumonia. Right, here the answer will be pneumonia. Whereas you take the most common cause of indirect lung injury causing ARDS, thus here the answer will be sepsis. Right here the answer will be sepsis. Okay, so this is an important point that you should remember. Next, now you come back to this question now. So if you see this question, acute lung injury is caused by all except, options are aspiration, toxic gas inhalation, cardiopulmonary bypass with heart-lung machine, and lung contusion. Lung contusion I have just said you, right? If there is any trauma to the chest, right, there the individual can have the ARDS. So lung contusion is also one of the etiology causing ARDS. So the answer here is the cardiopulmonary bypass with heart-lung machine will not cause ARDS. But remember, post CABG, the individual may land up in ARDS. Okay, so this is a point that you should remember. Next, now let me discuss one more question regarding the etiology of the ARDS or the features of the ARDS. Normal pulmonary capillary wedge pressure with pulmonary edema is seen in left atrial myxoma, high altitude, pulmonary venous obstruction, pulmonary arterial obstruction, right? So in all these options, he is asking us which of the following will cause normal pulmonary capillary wedge pressure with pulmonary edema. Now I should explain you here what do you mean by pulmonary capillary wedge pressure first, and in which clinical conditions the pulmonary capillary wedge pressure is increased, and in which clinical conditions the pulmonary capillary wedge pressure will be normal. Now, if you see a rough image over here, right? So this is only a diagrammatic representation to have a proper concept, right? This is not how actually the organs will be there in our body, right? Let me just give you a conceptual image, right? Now you consider this to be a 4-chambered heart. Now in this 4-chambered heart, like what we have, the right atrium, right ventricle, left atrium, and as well as the left ventricle. Now you see we have the pulmonary artery which is coming out from the right ventricle, and then it divides into RPA and as well as the LPA, that is right pulmonary artery and as well as the left pulmonary artery. The right pulmonary artery, remember, right, it continues as the pulmonary capillaries in the right lung, and left pulmonary artery, it continues as the pulmonary capillaries in the left lung. Now if you see here, so this you consider it as the lung parenchyma. Okay, now you see a point here after the pulmonary arteries. So what is its continuation? Its continuation is in the form of the pulmonary veins. Now these pulmonary veins, the exchange of gases will occur across the lung parenchyma, and later on you have the continuation, that is the pulmonary veins. So you have, this is the pulmonary artery, these are the pulmonary capillaries, and then you have the continuation as the pulmonary veins. So these are your pulmonary veins which are carrying the oxygenated blood after getting oxygenated in the lungs. Now, what is your pulmonary capillary wedge pressure? That is the question that need to be answered here. Remember, pulmonary capillary wedge pressure means the pressure which is present within the pulmonary capillaries, right? So the pressure which is present within the pulmonary capillaries, this is called as pulmonary capillary wedge pressure, right? This is called as pulmonary capillary wedge pressure. Now, what does this pulmonary capillary wedge pressure represent actually? Remember, the pulmonary capillary wedge pressure represents the left atrial pressure, right? It represents the left atrial pressure. So whatever is the pressure which is present in the left atrium, that is reflected back into the pulmonary capillary. That is what is called as your pulmonary capillary wedge pressure. Now, a point that I wanted to tell you here is that, now for example, if there is increase in the left atrial pressure, right, due to some reason, for example, you take the patient is having mitral stenosis. If the patient is having mitral stenosis, what will happen to the left atrial pressure? Because the blood cannot move from left atrium to left ventricle in a patient with the mitral stenosis adequately, the left atrial pressure increases. The pressure within the left atrium, once it is increased, the pressure within the pulmonary veins is also increased. Now the pressure once in the pulmonary veins is increased, indirectly the pressure within the pulmonary capillaries is also increased. Right? Indirectly the pressure within the pulmonary capillaries is also increased. Now a point that you should understand here is, once the pressure within the pulmonary capillaries is increased, what will happen is the fluid, it slowly starts getting exuded into the alveoli. Right? The fluid slowly starts getting exuded into the interstitium first and then later on into the alveolar parenchyma. Now this will make the individual to land up in what is called as pulmonary edema. So here what you should understand is the pulmonary edema whichever has occurred, that is because of increase in the pulmonary capillary wedge pressure, that is due to the pathology in the heart. Right? What is the pathology in the heart? That is mitral stenosis. Or for example, you take the individual has left ventricular failure. Right? The individual has left ventricular failure. When the individual is having left ventricular failure, now tell me a point here. Can the left ventricle send adequate blood into the aorta once it is failed? No. Because the contractile capacity of the left ventricle is reduced. So the left ventricle cannot send adequate amount of blood into the aorta. So thereby the left ventricular end diastolic pressure increases. So now as the left ventricular end diastolic pressure is increased, that is reflected into the left atrium. Right? That is reflected into the left atrium. So indirectly there will be increase in the left atrial pressure. So once the left atrial pressure increases, and that will be reflected back into the pulmonary veins and then into the pulmonary capillaries. There also again the pulmonary capillary wedge pressure increases. So once the pulmonary capillary wedge pressure increases, the fluid starts moving out from the pulmonary capillaries into the alveoli, resulting in what is called as pulmonary edema. So what I want to tell you here is, if the individual is landing up in pulmonary edema because of increase in pulmonary capillary wedge pressure, that is called as a cardiogenic pulmonary edema. Right? That is called as cardiogenic pulmonary edema. So in this scenario of increase in the pulmonary capillary wedge pressure, the individual will land up in what is called as the individual will land up in what is called as the cardiogenic pulmonary edema. All right. Now for example, there is no increase in the pulmonary capillary wedge pressure, but because of certain inflammatory pathologies, right? Because of certain inflammatory pathologies, there is rupture of the pulmonary capillary. Right? Because of the inflammatory pathologies, there is rupture of the pulmonary capillaries. Now, once there is rupture of the pulmonary capillaries, what will happen? The fluid from the pulmonary capillaries, it starts moving out into the alveoli. Right? It starts moving out into the alveoli. That also will result in pulmonary edema. Right? That also will result in the pulmonary edema. Is that clear? Now, this particular type of pulmonary edema, where the pulmonary capillary wedge pressure is normal, but still the fluid is moving out from the pulmonary capillaries into the alveoli, is called as non-cardiogenic pulmonary edema. Why there is pulmonary edema here in case of non-cardiogenic pulmonary edema? It is not because of the cardiac pathology. It is because of some inflammatory process which is taking place in the lung, and that inflammatory process has damaged the pulmonary capillaries, and due to which the fluid from the pulmonary capillaries is moving into the alveoli, and that is resulting in what is called as the pulmonary edema, and that is what is called as non-cardiogenic pulmonary edema. Right? That is called as non-cardiogenic pulmonary edema. So this is a very important point what you should understand. So in that particular clinical scenario where the pulmonary capillary wedge pressure is normal, right, where the pulmonary capillary wedge pressure is normal, this will result in what is called as, right, this will result in what is called as non-cardiogenic pulmonary edema. Okay, so if pulmonary capillary wedge pressure is increased, that is cardiogenic pulmonary edema. If pulmonary capillary wedge pressure is normal, that is non-cardiogenic pulmonary edema, right? This is a very important point what you should understand. Now we will go back to the question, right? So what does the question is asking to us? The question says normal pulmonary capillary wedge pressure with pulmonary edema is seen in left atrial myxoma, high altitude